We are the team of Ana Karen, Erika, Raúl, and Miranda, and we're going to talk about in this presentation about technologies for evaluation of the circulatory system. The first technology to be evaluated is the ultrasound. There are two types of ultrasound: the vascular ultrasound, which is a non-invasive diagnostic tool that uses ultrasound to evaluate arteries or veins, and the echocardiography, which is the same, but it characterizes structure and function of the heart. So how does this technology work? First, a transducer that is held against the skin emits the ultrasound waves that will travel through blood and soft tissue. These waves will scatter and bounce back when they encounter dense tissue or blood-moving cells that are within the blood vessels, and they will return these waves to the ultrasound machine. The waves will be collected by the transducer and then digitalized to a real-time image that will provide structural information about the vessel. Denser tissue will deflect more ultrasound and will be represented on the image with a brighter pixel. The speed of the sound waves returning to the ultrasound machine are used to calculate the speed of the blood flow in the vessel. So if this speed is very fast, it will indicate a narrowing or blockage of the vessel. The ultrasound can do the following things to evaluate the circulatory system: range finding, time position, and real-time 2D images of the heart. 3D volumes, it will measure cardiac volumes, monitor wall motion, direct visualization of the arterial wall itself, evaluate valve and intercardiac masses, identify structural defects, and it can measure flow patterns in the chambers of the heart using the Doppler effect. So, talking about the Doppler effect, it measures physical parameters of the blood flow, such as blood flow rate, areas of distributed flow, and valvular regurgitation. The mechanism of the Doppler ultrasound is the following. The waves will strike moving blood cells and are reflected back to the transducer. The frequency of the returning wave is modulated by the direction and velocity of blood flow according to the Doppler effect. So, this effect, it demonstrates a changing frequency of a wave in relation to an observer who is moving relative to the wave source. And in this picture, we can see how the Doppler effect works. This picture here. And this image shows an ultrasound scan with the Doppler technique. So it displays as a color image with a gradient color map corresponding to the blood flow rate. Here is the vessel. And another type of ultrasound will be the intravascular one. This ultrasound uses the same technique as external ultrasound, but with miniature transducer at the end of the catheter to produce images of vessel structure from within the cardiovascular system. The intravascular ultrasound eliminates scatter by other tissue and deep penetration issues. It will provide also information about vessels narrowing, plaque size, and composition, as well as valve functionality. And in this figure, we can see how the intravascular sound works and how the image will look. This figure.
We'll talk about pneumatics, the pneumatic devices, and pneumatics is a branch of engineering that uses compressed gas or works with gases and is used to power the devices. In medicine, pneumatics is used heavily in oxygen concentrators, infusion pumps, ventilators, wound therapy, blood analyzers, pressure cuff devices, medical bed surfaces, breathable gas delivery system, anesthesia devices, etc. So as we can see, pneumatics in the field of medicine is very important, and many devices are used, and in some of them are diagnostic devices, diagnostic technology. The first one is the blood pressure cuff. So this is a device that is used to measure the blood pressure of a patient, and it is also used to create a bloodless surgical field. So this is a device that uses an inflatable cuff, as we can see here in this figure. It uses an inflatable cuff to stop the blood flow of the artery, and in the surgical field, it's maintained that way, so it creates a bloodless surgical field. But in diagnostics, it slowly releases the air pressure in order to measure the pulses and the blood pressure of a patient. And this works because as the air flows out, it will equalize, the pressure will equalize the blood pressure of the artery, and this will cause this will result in a slow turbulent flow of blood in the artery that causes vibrations and a sound. And as the flow of air goes out, then it will reach a point where the pressure is the pressure of the cuff will be the same as when a normal blood flow is in the artery, and this will cause no vibrations. So these vibrations in this stage indicates the systolic blood pressure, and this also point where there is no vibration indicates the normal blood flow or the diastolic blood pressure. Next, we can see the pneumatic blood analyzer, and this is not strictly Well, it is a diagnostic device because using electrodes, it measures the amount of hydrogen, carbon dioxide, or oxygen inside of the blood. And well, this is used to analyze the blood gases, the pH, electrolytes, and other metabolites. This uses complex mechanisms, but it also works with gases. Next, we have the infusion pumps. That is very important in the medical field because it delivers fluids, and it is used. It is strictly not of diagnostics, but it is very important for the care of the patients in delivering medical fluids. And we have 5 types, which is the syringe pump, elastomeric pump, peristaltic pump, multi-channel pump, and the most used one, the smart pumps. And these smart pumps have alarm devices, alarm integrated, and other such mechanisms that alert the doctors of the good use or the bad use of the infusion pumps. And finally, we have the anesthesia devices. These are very important for the surgical field, and they work with gases because everything is administered with via the oral cavity. So yeah, the anesthesia, the inhalation of the station administers mixtures of oxygen, nitrous oxide, and anesthetic to the patient in order to make them sleep or not feel anything after the surgery.
Now we're going to be explaining electronic transducer devices. And well, first it's important to define what a transducer is. And this is basically a device that converts one form of energy into another. And in the context of biomedical engineering, this means that we're going to convert biological parameters to electrical signals. And these non-electrical parameters can be temperature, heart sound, blood pressure, and these are going to be measured from the human body with the help of electronic equipment. So for general knowledge, there are 2 types of transducers. We are going to find active transducers, which are going to convert one form of energy into another form without using external power sources, and there are several types. For example, magnetic induction, piezoelectric, photovoltaic, or thermoelectric types. And an example that is common to us is the photovoltaic cell, which basically converts light energy into electrical energy. The other type of transducer is the passive one, and this one is also going to do the same thing, converting one form of energy into another form, but with the help of an external power source. And this is basically using the principle of controlling the DC voltage or an AC carrier signal. And again, we're going to have several types, the resistive type, the inductive type, and the capacitive type. And a common example of this one is the strain gauge, which is going to convert a displacement or a mechanical elongation produced by a certain force, and it's going to convert it into the corresponding change in either resistance, inductance, or capacitance. And when we are talking about the circulatory system, transducers are commonly applied to, for example, a pressure monitoring transducer kit. And what they basically do is obtaining blood pressure information from a pressure monitoring catheter, and it's going to send it out to a patient monitoring system. And we can see on this image to the right an example from a medical device company called Edwards. And here we can see that it's basically a sterile single-use kit, and it could also be coupled up with a venous arterial blood management protection system. And this is basically so that it is a single, safe, reliable, and accurate monitoring solution. And quite similarly, there is an ultra-miniature pressure volume catheter, which is most commonly used for animal experimentation. And this is basically inserted directly into the heart, and it's great because it doesn't have an effect on the fully functioning organ. So without it being intact, we're going to have a very good reading of the pressure sensor, and some also include electrodes. So we can have a simultaneous measurement of both ventricular pressure and volume. That's it for transducers, and thank you.
About X-rays and contrast substances. X-rays are a form of high-energy electromagnetic radiation, and contrast substances is an agent that enhances the radio density, shown like in this picture. The X-rays passes through the body, and this energy is absorbed by the body structures. Bones absorb them completely, therefore they are very clear to identify. The X-rays passes easily through less dense tissues such as muscle. The identification of density, shadows made by the tissues and structure are a part of this process. This starts to generate an image where the form of the structure studied shows up. The X-rays are used in CT, radiography, mammography, fluoroscopy, and also in therapeutic. The contrast substances changes the way X-ray passes through the body. It is used to contrast a structure of the body which normally isn't as visible, such as blood vessels, gastrointestinal tract, etc. These are administered orally, rectally, or intravenously. Iodinated contrast is commonly used in cardiology for the vascular and heart studies. Now, contrast radiography. This is a method to study organs by using the X-rays and a contrast agent. This is commonly used to evaluate different conditions in cardiology. Some of the applications in cardiology are the following: the angiography, which is a study that examines the performance of blood vessels, obstructions, and tumors. The cardiac characterization, that is a study that examines the heart and its corresponding vessels. The chest X-rays, that help the evaluation of the cardiothoracic ratio, evaluate an ischemic heart, evaluate morbidity and mortality, evaluate fluid around the heart, and contrast substance in cardiac MR and in cardiac CT, that is the evaluation of the coronary artery. Now, these are the references. Thank you.